Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk some about in adult orthodontics. You find all sorts of problems in here, and so you just use your own ingenuity to figure out ways that you can fix somebody up like that. And I usually work with whoever sends the person in, the restorative dentist, or you can have somebody that puts implants in there, or you can have them bridged in there, or you can make a partial, or you can make a temporary device that they wear till they can afford to do it like they want. So let's get in with this, and I'll try to show this in a few minutes. A real nice lady. You got just a ton of this adult orthodontics that you can do. Now this lady has got a closed bite, and you can see that right off the lower upper teeth are coming down here, and there's nothing over here to hit much, so the teeth are kind of angled off in this direction. Now we want to come in, and if somebody dentist sends them in, you're going to put these teeth in correct positions, open the bite where you got room for the teeth to fit in, and then somebody can come in and put a partial or bridge or implants, whatever they want to do, and restore the teeth like that. So let's look at it. We'll line up the other part of the mouth just like you would do in regular orthodontics on it. And here we've got a partial denture that somebody comes in wearing this like this, and this is fitted over here, and you've got this, but then you've got these big spaces up above and everything, so you can't really use that thing. So we're going to take that out, maybe cut it in a piece out of it, something like that, where you can fit it in, and then we can come in and close this up and open the bite. Just do everything as possible in here. So we've got everything lined up. Now we're using these little bitty tiny brackets, and I recommend those. That's the nicest thing. Now we put a up bend arch wire coming in like that, and that holds this space open so you can work with this with temporary partial. You can take that partial they've got and use it back there, and then you come up here and straighten all the edge of your teeth out. So we're going to open the bite now, and so we're wearing a appliance, just a simple palatal deal with something that the teeth touch up here to open the bite. We cut this part of the partial off and put it into a retainer-like device, and we just wear that to open this bite. Excuse me. My voice is going out here. All right, we're working on the bottom, and now we've got them wearing this partial up above, and we'll straighten those teeth out. Now this is a regular intruding arch. It raises these teeth up back in here, or tries to, and you bite down on it, and we'll lower these teeth, line them all up. We'll close this space right there, and the space on the other side. So we'll run through that right quick. We've got our biting in the anterior part of the mouth, and so we work with somebody that's going to do this other work. Now we put this up bend in the arch wire so you won't bump it, and we can level that out that way. Now you got your cuspid. We're going to bring this into a class 1, and we put this lacing in here. This is what I wanted to show. And you can take and put your put an explorer between these wires and twist them down and pull these teeth together, and that's what we use that for. Now this is just a temporary thing. We're going to cut this out and let these teeth erupt on down in place. And so that's kind of what we did. We held that spot open so she can have a regular appliance, partial, that closes all the space, or she can have a bridge, and she can wear this retainer while we've got this leveled out. Now we open the bite. You see, these teeth were down here somewhere when we started. So we elevated that, level this out, and she'll get something, put it over there, and it'll look nice. She's got to wear this retainer while she's wearing this right here, so you don't have to worry about them wearing the retainer. Now it's kind of angled off to that side. You might trim a little bit of this off and make it look a little better. And then they can build a good partial or else bridge this from this side to the other side. Just put a long bridge in there. It's kind of hard to run off of this lateral, so you might want to put at least an implant and bridge on one side. There's lots of different ways so they can have time to figure out what they want to do, and they can wear that while they're waiting. Thank you again. Now you see that you've got these artificial teeth on that piece of that partial that she had, and we've got a little space on the bottom kind of opened up here. Looks like she had a crown built right there. And then she wears this, boy, you can see that when people got all these gaps in here, they wear this more than they should. I mean, you have to take this thing out and brush your teeth good and stimulate this tissue, keep it from getting inflamed. But we've closed all that up and just lined everything up as best you can. And down on the bottom, we're lined up pretty good. We got a 3-to-3 bonded retainer down there. And this is the way it started out. It was deep. And we opened the bite. And you see this cuspid was over here. We lowered this down. We brought this forward. And now this cuspid is coming right down in that slot. And we got the midlines pretty much on. Here we bit up the side that thing, and we're going to raise that up, and we need to trim this off a little bit, or else line that tooth up better, and you see level that out. And we open the bite. So these are just normal orthodontic things, but you're going to run into many, many situations where you come up and just innovative ideas of way you can restore something like that where the person is missing all of these teeth and they need to have something done in that area. So we've got something lined up over here. You can hardly tell. That looks like real teeth right there. And that's the way it was in here. And you can put teeth on this and have them push against the gum, and the gum will kind of grow over the end of the teeth, and it'll look natural, just really like they came from there. So there it is like that, and here it is with this temporary deal made. Or you can wear that the rest of your life if you want to. So let's hope that you get something from this, and you can see how to do that. And this is the treatment in here and how we do cephalometric training and everything on it. And there's the missing area. And we checked her jaw joints. But the head of the condyl's kind of messed up in here, so she's got a little bit of a TMJ problem too that we may have helped that. And so that's the temporary deal. Thank you for watching, and I hope you get something out of this. and hope you'll join our group and subscribe to it. And if you need to learn some of these things, it's good to go and get somebody to help you. Then you go to the American Orthodontic Society, and they have teachers or people that are sit down with you. They're headquartered in Grapevine, Texas, and I hope you'll learn about them, and you can go and you can come from any country. We wish we could get out to send this stuff to other countries by some electronic ways to help people learn orthodontics all over the world. So thank you for watching, and I'm going to say goodbye.